Nigeria's first case of Ebola was found in a Liberian, Mr. Patrick Sawyer, who came into the country through the Lagos airport. Since then, at least 3 people have died from the virus, and over 150 people have been placed under surveillance. My guest gives an analysis of government's effort to curb the spread of the virus in Nigeria. Hello there, thank you for joining us. Welcome to Dateline Abuja. I'm Gloria Umezuke. Well, hundreds of people are dead as the worst Ebola virus outbreak sweeps through West Africa, sending fear across the region. Well, to this end, international support has heightened while nations take stock of the effect of the outbreak. Now, my guest this week is the project director of the Institute of Human Virology, Nigeria. He speaks about the Ebola virus disease. But up ahead, President Goodluck Jonathan presided over an emergency meeting with state governors to discuss the Ebola outbreak.
President Jonathan was said to have emphasized the need for everyone to work in unison to overcome Ebola, as the Minister of Health gave the status report.
2 Nigerians, 1 Liberian American are dead. 7 are alive, many of them making progress. Then in terms of surveillance, presently in Lagos, 177 persons who are both primary and secondary contacts are under surveillance. Now, with the end of the 21-day maximum incubation period, those who are primary contacts who have not developed the disease will no longer continue to be on surveillance. In Enugu, we have 21 secondary contacts, who are on surveillance. All of them are secondary contacts because the contact they had was with a primary contact, one of those who participated in the treatment of the index case. That person is actually part of the 10 cases confirmed of Ebola virus disease in Nigeria. And that person is receiving treatment in the treatment center in Lagos. But all those contacts that are now secondary contacts in Enugu have been placed under surveillance.
On information, provision of facilities, isolation centers, surveillance in every state, and laboratory for diagnosis, he said there are provisions all over the country and dispels rumors on the spread of the virus.
In Abuja, we had 2 cases reported by 2 different hospitals. Both of them are negative for Ebola virus disease. In Anambra, the case that was thought, a corpse that was brought from one of those 3 main countries, Liberia, and people were afraid, having come from Liberia, could it be Ebola virus disease? We've evaluated all the primary contacts, all the mortuary attendants, morticians, family members. They were all tested for Ebola virus disease. They are all negative. In Abia, one of the papers carried over the weekend, we have thoroughly investigated. Clinically, what that patient has is called Steven Johnson syndrome. It's a drug reaction to an anti-malaria she took when she had malaria. But nonetheless, we've taken blood, and hopefully tomorrow or next, the result of the blood test will come up. But clinically, we're satisfied it is not Ebola virus disease. In the case of Imo, a corpse that was brought from Liberia, again, the state authorities notified us. And when we started the investigation, we found actually they had a proper medical certificate of death issued properly by the hospital. That person did not die from Ebola virus disease. So we are satisfied and okayed it for normal burial.
For the governors present, what is important is for everyone to know what to do at each point in time. They call for equipment for health workers, recommend quality control for equipment, and life insurance cover for health workers. They said that the challenge is on transparency and openness.
It's important to reinforce the necessity for transparency and openness across the whole country. This is not something you keep inside any religious house and be praying for. This is something you must report to us quickly so that in whatever place you are, we are able to respond, come and pick the patient. They're not patients also that you can move or you should move by taxis or by public transport. So it's important to understand this. If they need prayers in the isolation centers where care is provided for them, prayers can move by electronic and other means to come and move them there.
The country representative of World Health Organization commended the declaration that Ebola in Nigeria is a national emergency, while his counterpart in the Center for Disease Control said Nigeria is ahead in the effort to deal with Ebola virus. The meeting also brought to the fore the importance of keeping decent personal hygiene, as exemplified by the president and the governors present. Chukwuma Onwekusi, Channels Television News.
At present, there are 11 cases of the disease and several others under surveillance. But how is this being managed by the federal government? I'm being joined by Dr. Patrick Dakum. You're very welcome, sir, to the program.
Thank you very much.
Well, we have the world's deadliest epidemic right now in our hands, and we're wondering, what is your response to this? How would you assess how Nigeria has responded to this outbreak?
Well, first of all, I think the fact that we have a global emergency now, and the global emergency means that we in Nigeria will need to take it as an emergency. And from the first time that we heard about a case arriving in Lagos, I think the response both at the state level, I think I'll start first of all with the response of the First Consultants Hospital. That is a very, very commendable response, because if anybody is going to be given commendation for an initial response that really has helped us where we are now thus far, we will give it to them. Because first of all, on identifying the fact that here is a suspect case, immediately they started the process of ensuring some level of containment. Now, at the state level, I think one would confidently say that, you know, whatever it is that needs to be done, they are doing it in the right way and following global best practice. An incident center had been established by the federal government. And for virtually every public health emergency, you need a center that is peopled with epidemiologists and people who can look at the factors that are making this disease to move from person to person. And I think the incident center established by the Federal Ministry of Health is a commendable first step. I think second step, of course, is what is ongoing, and that is contact tracing and isolation of cases that have been confirmed or suspects that have come in contact with the primary case. So I think the effort so far, it's commendable. The public awareness is ongoing, and I believe that the more we can make that a priority, especially in border towns, the quicker we will be able to have it as a response that goes right down to the grassroots. It's one thing when we set up national bodies, it's another if corresponding units are set up at the state level, and especially at places where there is cross-border interaction between Nigerians and other nations, nationals, especially those coming from the areas of high risk.
Before I move forward, can this Ebola virus be transmitted through mosquito bite?
Definitely not. It cannot be transmitted via mosquito bite. The known mode of transmission is contact with the fluids of an infected person or infected animal. Like you know from the history of Ebola, it's said that most probably the reservoir within the animal world is the fruit bat, and possibly chimpanzees, gorillas, wild antelopes, etc. Now, contact with the fluid of an infected animal or a human being that is infected and is symptomatic these are the modes of transmission. The fluids that come out either from the skin, urine, stool, blood, direct contact, mucus, whatever it is that is fluid from somebody who is exhibiting symptoms, that is what can cause an infection with another person. So in fact, just even staying in the same room, if you are not in contact with either the linen or the fluid or the body of the person, you are not likely to get Ebola virus. And that is why we think that we know what the virus is. We know how it is transmitted. We know how to stop the spread. I mean, knowing that is giving us miles ahead in this fight or race with the virus.
This is quite unfortunate coming at this time when we're still dealing with security situation, insecurity in the country. Do you think we're making a lot of progress?
Well, I believe that it is another war in a different way because lives are involved. And wherever you have a threat to life, it's some war, one form of war or the other. The difference with this is that we are fighting it in a public health way, and that is prevention and preventive measures that are being taken at various levels. We are making progress because I think if we were not making progress, we would have more cases than we have had now. But so far, everyone that has been in contact with the primary case, and that's Patrick Sawyer, each person that has been in contact one way or the other has been identified. It's been contained. And now it means then that if they come down with the disease, like we have some cases that have come down with the disease, contact with those people are limited and the virus will burn out. It means then that if we get to the point where all the primary and secondary contacts don't exhibit symptoms and they have clearly been shown not to have the virus, we would have overtaken the virus as far as that incident case is concerned. Then we now deal with the issue of any fresh case that will come through any of the borders, air, road, sea or whatever. We now are moving in the same in a correct direction, and I think going, extra mile of community level awareness in this will take us a longer way.
Well, we have a lot of propaganda going on, people coming up with salt intake, this and that, and even we have religious angle to this. Some people say go to a certain church and you get healed. I mean, what's your perspective on all of this?
Anytime I hear that, I think we have got, maybe let me be a bit extreme in my comment, theological illiterates. The reason I say that is that we all are faith people. We believe in God and in the power of God. Of course, God will be able to cure anybody of any disease. But the decision doesn't lie with the person or with the clergy. It lies with God. Now, history, or if you read biblical history, is very clear that when somebody is healed, they say, go and show yourself to the priest. And that is show yourself to the lab scientist, who will now confirm whether the virus is there or not. If the virus is not there, how are you not sure God does not want you to wash 7 times in a river? And this river in this case will be the containment that we want. And this river can be also the hospital that you'll need to be quarantined or stay. So it is a theological fallacy to say that you have been healed, go away. It does not remove from your faith anything if you go and get tested. And if you are positive, it does not mean that God doesn't have the power to heal. He has the power to heal, but he will do it in his own way and in his own time. But confirm with the clinical people that you don't have the virus. And if you don't have the virus, confirmed by several tests, we'll rejoice with you. But why not do what is available that God has already provided? It is God that has enabled me to become a doctor. So he gave me the knowledge. And if he gave me the knowledge, it's for not for my use alone, but for the use of everybody. So he desires that you come to me as a physician, let me use the skills he has given me in order to take care of you. That's the method.